Hopefully here everyone has gotten their fill of candy and coffee. And so we're ready to sally forth here. I think that one of the things that's really interesting for me to observe as we are going through the series of speakers is how we really can see the different levels that patients are making an impact on. How we're starting sort of at this core, as I talked about, of affecting your own care, your own body, or your own family. And then sort of like ripples on the surface of water, you realize, well, this isn't going to get me very far if I just fix it for me. Or even if I can't really even fix it for me unless I start engaging in new ways to make changes on different levels. So the next two speakers who we have are going to really talk about how some of these ripples are moving outwards. And at the end, we'll sort of weave all of these threads together. So our next speaker is Marjan Faber, and she is a health scientist and leads the patient empowerment research at IQ Healthcare in Radbau, UMC. I'm going to give a shout out to all of her colleagues who are watching her online, in Nijmegen, in the Netherlands. Her main interest is to understand how patients can meaningfully contribute to their own care processes. The goal is to develop interventions that effectively alter the patient's role with a view to improving care and clinical outcomes. The research covers implementation of patient-focused interventions that have proven effectiveness in clinical practice. And a major part of her research is done in care for people with Parkinson's disease, in close collaboration with ParkinsonNet, which she'll tell us more about tonight. So please help me in welcoming her. Welcome.
Thank you. Thank you for inviting me here. It was a long journey. I left early this morning from the Netherlands, from Nijmegen. But I think it's worthwhile to be here, to see so many people engaged in Parkinson's disease and want to make steps forward and move forward. So I will share with you my experiences, my Dutch experience actually. I will tell you, not about the tulip fields, but I tell you about a Dutch model that we developed called ParkinsonNet to organize care for Parkinson's disease. But I will also tell you a lot about patient engagement that fits very well into this model. And during my presentation, I invite you to think about the messages and the lessons that we learned, how they may apply to your country, to your own care, how you experience it. Because I think that's the meaning, that's why I'm here. I'm going to share our experiences from a different country, and I would like to leave something here with you that you can bring forward. I will talk about guidelines, because ParkinsonNet, it was born. It started from guidelines, and in the Netherlands, at least in the Netherlands, we have lots of them for Parkinson's disease. It started with a physical therapy guideline, but nowadays we have a bunch of guidelines for other professionals as well, and we have a multidisciplinary guideline. It was launched in 2010, and I think that is very well needed. Parkinson's care is multidisciplinary. You don't see only your neurologist, although it looks as if a Parkinson's disease sees a neurologist twice a year. There are so many others involved. Later this year, there will be a European guideline for physical therapy in Parkinson's disease. I think that will really boost quality of physical therapy, at least for Parkinson's, and probably it will be also help to implement ParkinsonNet kind of concepts in other European countries. I also will talk about patients' participation, because we noticed during all the, especially focus group and interviews that we had with patients, that they really want to participate. Some do know how to do it, but others don't know, but they feel a need to participate. So I will tell you 2 examples how we dealt with that. But first, a few minutes to explain to you the basic principles of ParkinsonNet. It's quite simple. In 5 steps, you'll know what the concept means. So starting a ParkinsonNet region, actually it's a region. You start with a region identified with a regional hospital and a geographical region around it. And there are numerous healthcare professionals in this region. In the first step, to build the network, we start to select dedicated therapists. It was just like sending out invitation letters. Everybody could join who was interested in Parkinson's disease. But we decided that we only needed a limited number because it is important if you can provide expert treatment, you need to see quite a number of patients. So it's not good to have many experts in a region, but you only need a few to treat the patients living in this area. Okay, so next we trained these therapists. They got a 4-day training course on treating Parkinson's disease, but also general principles about what the disease means, what kind of symptoms you encounter, and how to treat them. And for this, we really needed the guidelines. As I told you before, we have guidelines, and we use this model, these training sessions, to teach all the therapists about what was in the guideline, because that was the latest evidence how to treat the disease. So then we had our experts already. What we did also, we promoted communication between these experts so they could exchange stories or problems they encountered while treating a patient. But they also could refer to each other. So this communication within the network, it was supported by an online tool. So especially the communication was online. And these therapists have meetings, regional meetings, probably 2-3 times a year, so they can also exchange experiences to keep their level of expertise on the right level. We also emphasize it's important to make expertise visible, so it's clear for patients where to find an expert. It's clear for referring neurologists, for example, where to send out your patient if you want to have an expert treatment. Well, these are the 4 steps. This is what we did to create ParkinsonNet regions. Well, the country is not very big, but we have 66 regions, networks, local networks across the country. It took us over 5 years to have a national governance. So it's not a thing that you do starting today, you have a network tomorrow. It takes effort, it takes time. But now we have almost 3,000 members. They're all trained. They're all connected to ParkinsonNet. And what's nice about it, we started off with the physical therapy, but now 15 different disciplines are connected to the network. So because you have this regional orientation, this is very good for collaboration between the disciplines and for good patient care. This is crucial. When a patient is treated by a physical therapist, it's important that that other disciplines are involved as well. For more information, we do have an English website, so you can find more information over there. What is very special about ParkinsonNet is this. This is our annual meeting. Once a year, we come together with as many people as that fit into this room, but it's a meeting with 1,400 people, members of our network, and they all come to Utrecht, which is in the center of the country, and they just meet. We have presentations, we have workshops, but it's a very social event actually, and it's great. It's the atmosphere. It's tremendous. It's very, very impressive. But this is also the strength of our organization, of the network. We started this as actually scientific research. These first networks, they were meant actually to demonstrate what the impact was of this kind of organization of care. So we now have evidence that organizing care according to this model leads to better quality, fewer disease complications, and this is especially true for hip fractures, greater patient participations at lower costs. Well, I think this is a perfect picture for patients, for providers, for healthcare policymakers. So we are really proud of this, and so I want to share with you our experiences. However, we are not there yet. I think ParkinsonNet, as I just explained to you, is a foundation to build on. It's a very strong foundation, but we use it now for innovations in care, for stimulating patient participation. In my opinion, you cannot push patient participation if you don't have the experts in place. So I think this foundation is strong, and now we're starting to build on that. Of course, I will show you how we deal with the new roles for patients. I think this is for the audience quite interesting. And I will show you two examples of patient involvement. We don't mean that patients have to become a manager, deciding and a doctor listening. No, we are striving for participatory care. So meaning that the professional patients are working together. Such a situation. We started with defining what actually quality is for patients. Probably it's in line with what the previous speaker. So also we decided to talk to patients. We explored how they experience care, how they experience their own disease, and what their needs are. What do they expect from their providers? Very interesting conversation. We had 8 focus groups with patients, but also with caregivers. Only 60 participants produced 2,700 statements. 2,700 statements all over the place. Well, one of our researchers tried to organize them, but I will share with you a couple of quotes. They are all isolated specialists. My experience is that they do not apply an integrated approach. Well, this patient definitely feels the need for a multidisciplinary team that is not perceived currently. I would like to talk with somebody about the acceptation of the diagnosis. Just a few conversations about learning how to cope with the disease. Apparently, this patient was sent home after getting the diagnosis and actually would have liked to have some support. And finally, for me, the neurologist provides the medical part of the treatment, and the Parkinson nurse helps me to live with the disease. I can discuss everything with her. They have a separate but complementary role. Well, I think this is a very good expression how teamwork should be. In this case, just a neurologist and a Parkinson nurse, but for this patient, it worked very well. Well, remember these 2,700 statements, we turned them into a questionnaire so we could actually explore how larger groups of patients experienced their care. And we did this in a sample of Dutch patients, but we also went to the US and 1,000 American patients also filled out the same questionnaire. And guess what? There hardly were any differences between the Dutch and the American patients. Most strikingly, the part that they missed was information. Information provision was the weakest thing of the care that they experienced in both countries. What we did is we created performance feedback for the centers that participated. So based on their patients, the providers got information about how their patients rated their care, benchmarked to the other centers. So this is feedback from a group of patients back to the clinic that identified priorities for improvement, supported by narratives. And narratives also always are very strong, so I have another one for you. My greatest disappointment after being diagnosed with Parkinson's disease is that no one told me about the benefits of exercise. I was given pills. It was up to me to discover support groups, holistic treatments, other experimental treatments, etc. I'm disappointed there is no coordination between doctors and caretakers. No one is my advocate looking at the whole me. These capitals were used by this patient. So this captured a lot of frustration. I'm not sure, but it's powerful to read this. Okay, as I told you, we got a lot of priorities for improvement, and information provision was key. A lot of information was needed. Also, patients indicated that they would like to have an more active role in their care process, and they lacked emotional support. So these priorities, they came out in the American sample and in the Dutch sample. Well, back to ParkinsonNet, we try to innovate. So we launched Parkinson's TV. It will start in April, and on a monthly basis, we will have a meeting like this, not with presentations, but an online meeting with experts and patients that can post their questions, and the experts will answer on television, well, online broadcasted. So this is a way, a new way to provide information that's tailored to the needs and the questions of patients. We also had 2 years ago a very nice glossy magazine with all kinds of information. Another way of providing information is this. This is an atlas. It's presenting quality of care across the ParkinsonNet regions. And it makes clear that there's variation. Not in every region, patients receive as much as physical therapy as in other regions. So in the lighter areas, less than 30% of the patients receive physical therapy, whereas in the dark red regions, over 60% of the patients receive it. So it's a huge difference. And now it's up to us to level out and to improve in the weaker regions. So that's one of the next steps that we will make to improve. Okay, as I told you before, there's another wish of patients to get involved in decision making. This is also a good area to do research and to make innovations. So first, a little bit about shared decision making when you're talking about involving patients in decision making. Of course, there's always research evidence. Sometimes a treatment is so beneficial, there's no discussion. But as soon as the evidence is not clear, it becomes relevant to include values of patients and preferences and include a context in which the decision needs to be made. Well, you can identify a number of steps at which it starts with the provision of information, again, information, and then start to talk about preferences. What matters to you? And the challenge is to integrate these preferences in the final decision. For Parkinson's disease, we selected one treatment option that is actually suitable for shared decision making. And that is when disease progressing and medication is not adequately dealing with the symptoms, and then we can talk about advanced treatments. In the Netherlands, we have 3 options available. That is apomorphine, DBS, and levodopa. Totally different treatments. And from focus groups and interviews, we know that patients are not really involved when this decision should be made. Well, to make an improvement, we had patients participate in the research projects extensively. We first wanted to map the current decision-making process and actually what the needs were. Patients were involved in focus groups, interviews, and a survey and a large sample. Then we decided to design a decision aid and to define an optimal decision-making process. Again, patients were involved in brainstorm sessions to build this. And we had a decision aid that was tested in 2 cycles. Few quotes here about this decision. There are people who consider the operation, and that is DBS, so easy. It is like removing a pimple, but it's different for everyone. That was a disappointment for us, how serious the operation was, and we never thought of that beforehand. Apparently, this patient said yes to DBS when a neurologist proposed the treatment, but didn't actually realize what the impact would be. Okay, the second one, nothing was discussed. I asked for it after seeing a video on television. You know, I didn't want it anymore. I was just so glad he was going to do something else. This is a desperate patient that actually was in need for other treatment options, but the neurologist never brought it forward. So from our research, we know that there's a need for more support for shared decision-making for this particular decision. So we need a few steps more. We are building an information sheet that can be used during the consultation. We are building a website with all the background information for the neurologists, but also for the patients, because we noticed that neurologists also don't have everything in place. The good thing is this will also become available in English, so it's not only a Dutch thing. But this needs a little bit of work, and then we can actually share it with you. That was my presentation. On behalf of the entire ParkinsonNet team, I would like to thank you for inviting me again, and thank you for your attention.
Thank you so much, Marjan. That really sparked a lot of questions for me already.